You started Ozempic or Mounjaro, or maybe you're just thinking about it, and you're wondering, what are the GLP-1 side effects no one seems to be talking about? Or doc, is there anything or something I can do to manage side effects if they happen? Today, I'm sharing 10 common but surprisingly manageable Ozempic Mounjaro side effects you're not prepared for. Some are harmless, some are bizarre, some are serious enough to talk to your doctor about immediately. It's time you know the difference. Stick around, because coming up later, a side effect that makes patients think they have a serious illness, but it's actually temporary. So let's get into it. Side effect number 1, feeling fuller than full. This is different from regular fullness. Some people describe it as Thanksgiving level stuffed after just a small meal, and it can feel uncomfortable or even painful, especially early on. Some people describe it as the worst bloating ever, and that's because Ozempic slows gastric emptying to aid in digestion, but some folks have an exaggerated response. Here's a pro tip: eat slower. You should be practicing mindful eating anyway, so eating slower gives your stomach time to tell your brain it's had enough, so you don't overeat while you're on the meds. On to side effect number 2, Ozempic burps. Yes, this is real. Some patients call them sulfur burps, and these reported frequent sulfur-smelling burps, especially in the first few weeks, are more annoying than anything else. It's likely related to slow digestion and changes in gut bacteria producing gases they didn't before you started the meds. Think of it like a bunch of cowboys eating beans in a saloon and having a burping contest. That's what's happening in your gut. And it's not dangerous, but it can be, well, it can be awkward. Try probiotics, Akkermansia or mint tea, and again, slowing down your meals. Side effect number 3, dehydration from nausea or diarrhea. Ozempic can cause nausea and diarrhea, which leads to dehydration pretty fast. If you're suddenly feeling lightheaded or dizzy, especially when you change position, like standing up quickly from tying your shoes, or when you get out of a chair after sitting for more than like 10 minutes and stand up and feel a bit dizzy, sometimes you'll even notice your urine is a little bit darker and you're thirsty all the time. As a doctor, that's a red flag for me, and at least need a call from you to let me know what's going on. In the meantime, sip on some water, get your electrolytes. If you're feeling cramping, or you need to get on some hydration type fruits like watermelon, cucumbers. Here's side effect number 4, strange food aversions. One day you love eggs, then all of a sudden you inject, and the next day you gag at the thought. Ozempic can trigger weird food aversions even to things you used to love, and it's likely due to hormonal changes affecting your brain's appetite centers, meaning the meds are working, maybe a bit too much for your liking, so don't force it. Listen to your body. The aversions usually pass. Give it a couple weeks. Side effect number 5, hair thinning, and this one can be scary, and some patients think something is seriously wrong. But here's the good news. It's almost always temporary, and usually due to a sudden deficiency of vitamins and minerals like vitamin E, vitamin A. Now, rarely we see a more violent type of hair loss called effluvium telogen. When you lose weight quickly, some folks really get stressed out metabolically, and as a result, your body may pause hair growth to redirect resources. Ozempic itself is not the cause of the baldness, but pair it with fast weight loss, stress, or low protein, decrease in micronutrients like I just mentioned, this allows the hair shedding to happen. So stay calm. It usually resolves over the next 3 to 6 months. Make sure you manage any extra stress and replace micronutrients. Whether you are a woman or a man, prenatals are awesome for this. You'll thank me later. Quick note, before we continue, my YouTube analytics show that only 20% of the people watching are actually subscribed. If you subscribe, my promise to you is simple. I'll keep making the content you actually want to see. Practical, evidence-based medicine, real-world advice from a doctor who works with GLP-1 patients every single day. It's free for you to subscribe, but it means a lot to me. Now for side effect number 6, mood shifts or emotional blunting. Some patients report feeling emotionally flat or even a little down after starting Ozempic. It's not common, but it happens. If you notice mood changes, talk to your doctor and make sure you're getting enough sleep, movement, and personal connection with others around you. It might be fatigue, or it might be the start of rarely reported depression, so it's important to get evaluated quickly and see if stopping the meds is necessary for you. It's a rare cause of discontinuation of the medications, but it can happen. Coming up, the most underdiagnosed serious Ozempic side effect that many people kind of ignore. But first, side effect number 7, gallbladder issues. Rapid weight loss, especially with very low calorie diets, can increase your risk for gallstones. If you have upper right abdominal pain that after meals or nausea that won't go away, don't ignore it. Ozempic, again, isn't the direct cause, but the rapid fat loss can trigger it. Stay hydrated, eat healthy fats, and don't skip meals entirely. Keeping your monthly weight loss under 15 to 18 pounds a month seems to help as well. Side effect number 8 is going pretty fast. This is one we really don't ever want to see, and that's excessive muscle loss if you're not careful. This is a big one. Ozempic can cause lean mass loss if you're not eating enough protein or exercising properly. Remember, you want to lose fat, not muscle. Muscle keeps your metabolism strong, your bones protected, and your body firm, not flabby. Get anywhere between 80 to 100 grams of protein daily, and don't forget to lift something heavy a few times a week. Side effect number 9, the Ozempic Face and the Ozempic body changes. By now, I'm sure you've heard of the Ozempic Face, and if you have not, it's basically a term coined early in the GLP-1 movement where people suddenly appear to have all the volume drained from their faces as they lost massive amounts of fat. But it's more than that. Fast weight loss can affect collagen and fat distribution in your face, neck, and even hands. This leaves skin unsupported, and unfortunately, the skin sags as a result. It's not a side effect of the drug, it's a side effect of rapid weight loss. So stay hydrated, stay patient with the medications, and don't lose weight too quickly. And consider resistance training to maintain volume. Side effect number 10 is acid reflux or weird throat tightness. Some patients report heartburn or a sensation of food getting stuck when they take a swallow of the food. This is usually due to slower digestion and pressure on the upper GI tract. It can feel scary, but often it's just a sign you need to eat slower and take smaller bites. Side effect number 11 is constipation. This one is quite common, and basically the gut slows down to almost a halt. This happens more often to people who tend to have issues with constipation before they start the meds. If that's the case, prepare for this one ahead of time. Increase your fluids, walk more, and add fiber from the jump. And if you need something more, even after all that, this is one you will want to bring up to your doctor or get some guidance for it. Sometimes I even hold the medications, the Mounjaro or the Ozempic, until we get things moving. And then we start up again slowly and carefully to make sure these things don't recur. And if they do, we got control of them. So you have to monitor them very, very closely. And at number 12 is one that we rarely see, like I said, and let alone talk about, and it's injection site rashes. Some folks don't get a rash at all, but complain of itching near where they injected the meds. Others do actually experience redness along with the itching. Most times it lasts a few hours to a day after the injection and recurs every week when we inject. Annoying, but to some people it's alarming because they're not really sure what's happening and haven't been told about it. It's a known thing, and it happened in just about all the GLP-1 trials. No one had to quit the trials as a result, and it usually happens at the lower doses. Most patients lose the rash as the dose increases and time passes. And in the meantime, try applying a cold pack after injection or immediately rubbing the area where you injected the medication or letting the meds get nearly to room temperature before injecting if you're taking them out of the fridge. These measures typically calm the itch and rash down in my office. And as a bonus, since you stuck around, at number 13, pancreatitis. Now this is a problem, and thank goodness it isn't common. And I've only seen one case in the last 3 years. So much so that if you ever had the pancreatitis in the past, you shouldn't start GLP-1s at all. If while on the meds, you start feeling a knifing, burning pain that's heading towards your back, it feels like it's digging into your back, and it won't go away, you need to see a doctor. Evaluation is necessary because this may be pancreatitis and can be fatal if you don't treat it right. While this is one side effect where the medications are the direct cause, it's absolutely rare. And remember, the two major real causes of pancreatitis, or more often, is gallstones. Remains gallstones is number 1, and coincidentally can be caused by the rapid weight loss and the stones that we form when we are losing fat too fast, right? The other one is alcohol-induced pancreatitis. You shouldn't be drinking heavily on these meds anyway. It's never a good idea to mix meds and alcohol, especially with these medications, because it can cause pancreatitis directly. So while on the meds, please, please, please limit your alcohol. Well, that's it. All that's worth talking about here, at least for these side effects. The entire list of medications, the other ones that we've seen in the trials, would be too long to talk about, longer than a line at the DMV. So let's review. The most common Ozempic Mounjaro side effects, one by one, that we just talked about, right? Overfullness, number 1. Number 2, sulfur burps. Number 3, dehydration. Number 4, food aversions. Number 5, hair thinning. Take the prenatals, trust me. Number 6, mood changes and depression. Number 7, gallbladder issues. Slow down. And number 8, muscle loss. Lean muscle loss. You got to take your protein. Number 9, body shape changes in Ozempic Face. Number 10, acid reflux issues. Number 11, constipation. And number 12, injection site rashes. 13, the rarest of them all and probably the most important, and it is the most important, pancreatitis. It can happen. Most of these are manageable and avoidable. Some are even signs that the medication is actually working. But if anything feels off or you're concerned, it's always, always okay to ask your doctor about it. Look, if this helped, grab my free GLP-1 boot camp. It's a 14-day crash course on how to lose weight safely on these medications like Ozempic, Mounjaro, Zepbound, Wegovy. The link is below. Stay healthy, stay informed, and I will see you soon. Next video.